Our second presenter is Dr. Kathy Ramstetter. Kathy is a health educator with an interest in child and school health. Dr. Kathy Ramstetter is a school health consultant with Successful Healthy Children, the nonprofit she founded in 2015. In this role, she assists schools with wellness initiatives and is a researcher and advocate. Her aim is to protect recess for every child every day and to foster children's healthy growth and development intellectually, socially, emotionally, and physically. And Kathy also is serving currently this year as the secretary for the American School Health Association. To get her screen up and just thank you very much. I appreciate it. And Kathy is already prepared and ready to go to keep us moving right along. And so I will turn it over to you.
Okay, so you should be able to see my screen now and hear me at the same time, correct?
That's correct.
Okay, so as Casey said, I'm Kathy Ramstetter, and I am on the board, and I am with Successful Healthy Children, but I'm also here today to talk to you about how recess can support student success, and what you heard from Dr. G, what you heard from Marcy just now, and what we've been talking about all along is that this experience for all of us has been really traumatic. And one thing we need to really think about, and Dr. Ginsburg talked about this, was opportunities for children to have self-directed time in school. And Dr. Love's going to talk about this after me, about we have an opportunity to rethink how we do school. And recess is something that is near and dear to my heart because I'm the co-author of the American Academy of Pediatrics statement on recess and the value of it. So I'm not going to go into a lot of that's in this presentation. I want to skip kind of right to, I'll still show you the slides, but we're going to get really quickly through those so we can get to the parts and share strategies that our alliance, the Global Recess Alliance, which I'm having a hard time forwarding my slides here. Here we go, down here. So this is the Global Recess Alliance. This is who we are. Dr. Lauren McNamara here is the one who convened us at the end of March with the idea that as schools return, and we really want to rethink how we address this trauma and the need for schools to be a place of healing for students and teachers and all the adults involved, is we really need to think about how we do this time for people to connect safely. And children learn through play. From the time they're 5 until they're 17, they learn through interactions with their peers. So she convened all of us. We are an international body. We have members from Canada, that's where Lauren's from. We have a member from the UK. We have Pasi Stolberg, who is from Finland and now in Australia. And we have a researcher and educator in Australia, and then several of us from around the country representing researchers and educators and advocates for child health and recess. So we came together. We want to make sure that recess, if not done well, can look like this empty playground. And it's affecting our children who are most at risk. And we've heard this throughout the day. It's been a theme that our children in the poorest districts go to the poorest schools and they experience the least robust, meaningful, inclusive recess. And part of that's a resources thing, and part of that is the fact that we don't plan for it. So as we plan for school time, we need to plan for how we're going to do recess well, so it becomes a place for self-directed, child-focused play. So these are some of the challenges we've talked about a lot throughout the day. Some things have been a positive. You know, some people have had more opportunity with their family and siblings, but as we know, that hasn't always been a safe place for children to be. And there are many children in our country and in our world for whom school is really the safest place for them to be. So how do we make time for them to reconnect when they come back? And as Marcy just went through the ACEs that children experience, and children are experiencing anywhere from 1 to all of these. And somebody wrote in the chat that we often don't discuss parental death. And that is certainly something that affects children adversely. And these are all the other things that we measure pretty regularly. So, and of course, COVID's going to be just another lump on there. So why is recess important? And part of why recess is important is, as I said, that recess is the time for children to play and connect with each other. It's how they interpret their world. It's how they interpret the things we're trying to get them to teach or to learn. It's also the time when they get to explore and experiment and create those social emotional skills with one another. And the United Nations has recognized for many years that it is a child's fundamental right to play. Several countries in the world, unfortunately not the US, have adopted this right to play. And for many children in our country, even though we haven't adopted it, we all recognize it. A child needs to play. And safe play, sometimes the only place that's going to happen is at school, but we need to plan for it. And that's what I want to talk to you about. So I'm going to skip through some of these. We've talked about social connections and why that's going to be essential and important. So unfortunately, these pictures you see here are what we are actually seeing internationally in other countries where schools have already opened, whether it's because they were in winter break and they went back, or they opened or they started already. These little circles you see over here on the left image are where the children are supposed to stand at recess. I don't know about you, but that looks like a terrible way to try to connect. There's also this, where the playground structures themselves are just locked down and little kids are wearing masks. And then there's this, children just walking 6 feet apart to make sure that they don't, yes, they're outside, but they're not connecting in ways that are self-directed. So ideally, we don't want this to be a recess. This isn't a time for play. This isn't a recess that will be nurturing and supportive and return a child into your classroom ready to learn and process. And if we don't plan, these are the kinds of things that children experience: bullying, nothing to do, not enough equipment. And this is one child's response to a survey pre-COVID-19. So if we don't take the time now to do it well, we're going to have a lot more of this. So we need to take that time. So I hope that you'll hang with me and figure out some ways to do it. So children will need to have time to do all these things. And play doesn't have to only be physical. It's like, one of the people on the panel with Dr. Ginsburg talked about, Dr. G wants us to be, we're running because we're running from the tiger, but there are other ways to avoid the tiger. And so children will have different ways that they will need to move freely and express their fears and socialize with their friends. And then just to kind of, they may even role play what it's like to have COVID. That's how they interpret what they are experiencing in their world. So we need to make space on our playgrounds or our play yards or our schoolyards or our spaces, wherever they might be, for all different kinds of activities for children to engage in. And then to do it safely. We want to mitigate the spread of the virus. And this is a context from Australia. I just wanted to share this from my colleague, Brendan Heineman, in the Down Under. This is what looks like for children with employment stress in their family. This is the one on the left is pre-COVID. This is during COVID. Australia did go back to schools, and they did open, and they had some staging openings. They're now on winter break, and there are some provinces where they may not return after winter break because they've had issues in the community, similar to what we're seeing in the States with spike in cases. So there have been, these are some things that they are doing: staggering recess time, not putting as many children on the play yard as before. They're doing classroom eating for lunch to keep the numbers of students outside, all together in the lunchroom lower. But we also have seen the shutting down of playground structures because nobody can figure out how to clean them adequately between children. And there's been some, and then there are other schools where their structures are open. So this is how they're seeing it in Australia. I want to give us a US context. This is from Texas, from the LINK project with Dr. Debbie Ray down at Texas Christian University. They are engaged, the LINK stands for Let's Inspire Innovation in Kids, and they've been involved with schools for about 5 years. It's a model based on the Finnish model of recess 4 times a day, 15-minute increments. And they are returning to their schools at this time, as of the last time we spoke last week, with all 4 recesses in place. And the teachers are looking forward to that as an opportunity to really let everything kind of feel positive for the children and for the teachers as well. Notable, these are the things that they are going to be doing. They will have disinfectant stations at on the playground, and when they come back in, they will not be wearing masks or shields outside. And I think that's an important thing to note, as you may have been following what the AAP has said and some other research from the CDC and epidemiologists. The risk of transmitting the disease in outside moving air is much less than what is inside. As Dr. Gerba told us in the morning presentation, desks, computer, mouse, and seats inside are going to be higher warehouses for virus than being outside in the playground. So they will continue to have, I already have a practice with Link that the children bring their own water bottles to school, so they will continue with that. They will limit children in terms of how many can be on certain areas of the playground, but they will allow children to move freely, just being mindful of how many children are there. They're actually going to use backpack sprayers to disinfect so that they can clean in between quickly on any areas in the playground that do have structures. And they do support, it's free play, it's self-directed. The children choose where they want to play and the kinds of games that they want to do. Importantly, what they also plan for is teaching the children these empathic skills.
So I heard her connection going out, and because I couldn't see her, and I just had a feeling that was coming. As you can see, I was ready to go. So we will give Kathy an opportunity to come back on during the panel time, but I'm going to go ahead and transition into Dr. Bettina Love for her presentation, and we'll come back to Kathy when she logs back in. Welcome,
Right.
Dr. Love.
Sorry. Casey, sorry.
Okay, I didn't know you were able to get back in. I'll give you a chance to wrap up. I was turning over to Dr. Love. I was going to give you a chance.
I apologize. Dr. Love, I want to hear everything you have to say. So I just want to finish up with some quick notes here. How do I get back to sharing my screen? Do you see it?
At the very bottom, you do have your share screen green tab at the bottom.
Hold on, there we go. Share, there it is. Okay, there we go. So this is all in my presentation. I know I want to get to Dr. Love because what she's going to share with us is so essential. So this is I was just on the slide. We have the last 3 slides of this are about safety and what you need to plan for. And these are some policies to consider. You want to schedule recess twice per day. And can you count recess as instructional time? That could be a whole conversation with your district, but this is about the things you can do to really rethink how we can be different when we go back to school. Be outside as much as possible, using all the spaces we have in the building to have different kinds of activities, and then involving children. That's also been a theme that I've heard throughout our presentations, that asking the children what their experience has been like and what they need from us. And doing what we can to include their perspectives and their voices. Some practices, these are just some, as I was sharing with you about the LINK program, having separate bins, having different places, having hand sanitizers, and then minimizing contact sports, unfortunately, for now. But they can do other things, and that having a list of games that the teachers or monitors can suggest that are non-contact, but still connected kinds of games, and they're inclusive. Finally, this is probably something that if you've read the AAP policy statement, we do not withhold recess for any reason for punishment. And I think this is going to speak right into what Dr. Love's presentation is going to be about. And then I'm going to end myself, is that too often the children who have recess withheld for punitive reasons tend to be our boys, and there are boys of color, and that has to stop. So it's obviously, I'm on my soapbox now, so I'm going to end. Thank you for listening. I'll be around for the panel, and I'm going to let Dr. Love take it from here because I can't wait to hear what she has to say.